Hi, this is Divya Prakash. Setting up a high-dose therapy facility of nuclear medicine is a bit challenging, multi-step process, and requires a lot of knowledge of chronology of proceedings. Here we shall be discussing starting from site and layout plan to finally source procurement for clinical use. This will include all governing rules, regulations, references, staff requirement, accessories, design of delay tank, fume mode, etc. So let's begin. Let's see the rules, regulations and guidelines which speak about this. There is a ARB safety code for nuclear medicine facilities. This was issued in March 2011. There is a ARB safety guide for radioisotope handling facilities. This was issued in August 2015. There is another guide, consenting process for radiation facilities. This was issued in March 2011. There is a guideline for preparation of nuclear medicine facilities site and layout drawings. This was issued in 2017. And last but not the least, Nuclear Medicine Resources Manual. This was published by IAEA in 2006. Extract of these guidelines which is pertaining to high-dose therapy is mentioned in forthcoming slides. This will help you to just see what is related to high-dose therapy. This entire presentation can be downloaded from nuclearmedicinesolutions.in in PDF format. Let's discuss a staff requirement first and then we will move to site and layout plan. As a staff requirement, you need a nuclear medicine physician, a nuclear medicine physicist, also called as nuclear medicine technologist as per current safety codes, and a radiation safety officer who is trained in high-dose therapies. All RSOs of nuclear medicine are not certified to work as a RSO high-dose. There is a special training for this. AERB has recognized few institutions which are authorized to conduct such courses. The course includes 3 weeks of field training program with the minimum of 20 patients of iodine-131 and at least one with the other isotope. The duration is minimum 3 weeks, and if the number of patients is not 20, then the duration can be increased. So this is minimum criteria which needs to be fulfilled, and a certificate should be issued by the institution which is conducting the course for successful completion. A list of institutions which conduct such courses is shown in this slide. Now let's see the step-by-step requirement for setting up high-dose therapy facility. First of all, we need to take site and layout approval from AERB. We need to nominate a RSO for high-dose. Once layout is approved, construction can be started immediately. After completion of construction, we need to procure the accessories which are required as a part of radiation safety. That needs to be intimated to AERB. Apply for source procurement for radiation survey. Conduct the survey. Attach photograph of facility including accessories and delay tank. Fill commissioning checklist and apply for license for high-dose therapy. Once license is approved, apply for source procurement for clinical use. Now let's discuss site planning and design of facility. The facility shall not be located in residential building, should be away from general patients ward and public occupancy. The isolation ward should be located at one end of the facility and preferably contiguous with the other radiation facilities. While planning the facility, one should have in mind that it should be designed in such a way that it should have a low active area to the high active area, and the access control should be made accordingly. Floors must be lined. There should not be any cracks, joints, and walls should be painted with such a material that it should facilitate easy decontamination. In site and layout plan, we must mention the location of delay tanks, their overground, underground, occupancy around, and construction material with its thickness. Once planning is done, apply for site and layout approval through eLERA. Once it is approved, the construction can be started immediately. Typical design of AERB approved plan for high-dose therapy is shown here. Just see, this facility is of 2-bedded. First room is this and the second room is this. The entrance is from here. There is a corridor, room 1, room 2, and these two are attached toilets. Here there is a high-dose therapy dose administration room. This room is for contaminated linen storage, and this is radioactive wastage storage room. This plan also shows this plumbing line to delay tank and the position of 2 delay tanks along with sewerage line. Now we shall be discussing about the delay tank design and monitoring. As per AERB, 2 tanks of 3000 liter capacity each is required per bed. So if we are planning for 2 bedded facility, we need to make 2 tanks of 6000 liter capacity. The walls of the delay tank should be made up of concrete wall. They should be leak proof. There should be provision for sample collection for disposal of radioactive wastes. A tank monitoring system should be in place. Once all this is done, cordon off the delay tank showing display caution radiation area. In diagram we are showing there is an outlet from isolation ward 1, isolation ward 2. There are 2 walls here and 2 walls here. Means the entry and exit of each tank you can control and release the water to the main sewerage line as per requirement. This is a tank monitoring system which will tell you about how much tank is filled. This will give an alarm once it is completely filled. This slide will give information about the accessories required for high-dose therapy, such as survey cum contamination monitor, gamma area monitor, lead bricks, decay drum, forceps, nip tong, L bench, lead line, foot operated dustbins, portable lead barrier, decontamination kit, and dose calibrator. Most of these items are prerequisites of any nuclear medicine department. Only a few things like gamma area monitor and portable lead barrier may be required to be purchased. Once these items are in place, intimate ARB regarding available equipments through ELORA. There is another accessory which is very important for high-dose therapy facility is fume hood. Generally all the vendors of nuclear medicine know the design and construction requirements for nuclear medicine fume hoods. The catch is ARB is sometimes asked to quantify the phase velocity. The requirement is 0.5 meter per second, that is 100 linear feet per minute. What is this phase velocity and how do we measure this? The phase velocity is an average velocity of air drawn through the face of fume hood. It can be measured using anemometers. This is available online, costing around 3 to 4,000. Now record keeping. We need to prepare some files, some registers like radiation survey record, individual dose record for TLDs, calibration certificate of instruments, etc. The retention period for such records is 5 years, whereas dose record of worker should be maintained for lifetime or up to the age of 75 years and not less than 30 years after the termination of work. Some documents manuals also required to be prepared, and these documents such as emergency preparedness plan, radiation protection program or radiation safety manual. Ready to use documents can be downloaded from RSO page of www.nuclearmedicinesolutions.in. The link is given below. You can simply change your name, write institution name, licensee name and few telephone numbers and make it yours. The next step is to apply for source procurement for radiation survey. A 300 millicurie of iodine 131 for 2 bedded facility may be applied and procured once the approval is received. After receiving of activity, keep 150 millicurie of iodine in each room and do the survey. Survey should be done inside the room, at the level of door, after closing the door, in corridors, in surrounding areas, as well as 1 floor above and 1 floor below. The idea is to get the survey report of surrounding areas as well as 1 floor above and 1 floor below if 2 patients are there who are given with 150 millicurie of iodine. A draft report is shown in the slide just as a guideline. You can modify it, make it whatever you want. Once survey is done, take some photographs of facility accessories, cordon of daily tank. Fill a commissioning checklist. This is a 5-page document issued by EARB. Fill this commissioning checklist, sign it, and apply for license for high dose therapy. EARB may ask for some clarifications if needed. Once license is approved, apply for source procurement for clinical use. Commissioning checklist page 1 is shown in this slide. This is a 5-page document. Editable Word format is available on the website nuclearmedicinesolutions.in in RSO page. Regarding application for source procurement for clinical use. For a 2-bedded high dose therapy, generally one can get 600 millicurie of iodine 131 weekly, and if 1 millicurie of iodine 131 sacrificed, one can get 10 millicurie of lutetium 177 in lieu. So plan your requirement before and then apply. While applying for application for source procurement for iodine 131, choosing the option sodium iodide solution / sodium iodide capsule / MIBG would give NOC for almost all iodine 131 products, and applying for multiple NOCs can be avoided. For more details, go to www.nuclearmedicinesolutions.in, become member, subscribe this channel, press the bell icon and get notifications for latest videos. At the last, few disclaimers. This presentation is just a guideline for help. We do not guarantee the authenticity of any information shown here. Please check all the information and latest rules regulations from EARB site. Thank you.